Sciatica and that annoying pain in the buttocks coming up next. Sciatica is a figurative and literal pain in the butt. Pain in the butt. The literal pain in the butt can be tricky because it can come from many different places. And the thing is, if you've tried rolling on balls and you feel that ache in your butt and you put a ball there and you roll around, you think, oh my God, that's it, it's it. But it doesn't fix it, right? It doesn't fix it because it's actually not coming from where you are feeling it. That's the trickiness of trigger points. Self-trigger point release includes understanding the pain referral patterns of trigger points so that you actually know where to go to get rid of that pain that you're feeling. Now, sciatica pain almost always includes a pain in the butt. Sometimes when I had sciatica, that was the only pain I felt, was just this kind of gripping, this hot ache in my butt that would not go away, would get worse at night when I was sleeping, and it was debilitating, annoying, and frustrating. So I understand what you're feeling when you have that pain in the butt that won't go away. Sometimes it would radiate then down the outside of my thigh, sometimes ache in my hamstring, sometimes ache in my hip flexors, but really that pain in the butt seemed to be the thing that never went away. Part of the thing of this whole picture with sciatica and butt pain is, again, that it can come from many different places. So I just want to break down for you the multitude of muscles that can cause an ache in your butt. And I do a whole 3-hour-long workshop, multiple hour-long workshop on treating sciatica and butt pain. It's not something you can fix in just one 5-minute long video. So please understand, again, sciatica is a big picture. It incorporates and includes a lot of muscles. Because our bodies work, our muscles work as a symphony, no one muscle causes a problem. So it's helpful to understand what's the bigger picture. Take a step back, stop just grabbing your butt or sticking a ball around on a wall on your butt and trying to get rid of that pain. That isn't going to work. What will work is getting an idea of that whole picture and treating all the muscles in the system. One thing that can feel confusing, again, is those trigger point pain referral patterns can be very far away. One group of muscles that causes pain in the butt related to sciatica is the Erector spinae bundles along the spine. The Erector spinae begin at the top rim of the pelvis, go up along the spine and a little wider out on the rib cage, and they can cause aching in your butt around the top rim of the pelvis and even down low in the buttocks near the gluteal fold at the bottom of your butt cheek. So if you're getting a pain around the bottom of your butt cheek, it may actually be coming from up in your back, in your erectors. So I'm going to link a video on releasing the erectors at the wall so you can try it and see, do you have tension in your erectors? I'm sure that you do. And does it actually help that butt pain? Now, any one of the glutes muscles, the glute minimus, gluteus medius, or glute maximus, can cause aching in the buttocks. Glute max tends to gather its tension around the very bottom of the buttocks, near the sacrum, near the ischial tuberosity, the sitting bone. And if you roll around the bottom of your buttocks, that can alleviate some of the butt pain. It's also a muscle that tucks the pelvis under. So if you get stuck in a tuck, and that's part of your problem, then, and also that pulls the low back and can create the conditions for herniated disc, low back pain, and sciatica. So knowing how to release your glute max, super helpful. And I'm going to link a video down below to how to release your gluteus maximus so that you can check that out and see if that's a piece of your puzzle. Gluteus minimus is the sciatica imitator. It causes all of the sciatica symptoms. It causes weakness in the hip. It causes deep ache in the butt. It causes aching in the hamstrings, even down into the calf, aching along the iliotibial band, the outer thigh, down into the shin, even into the foot. It can contribute to that numbness. Gluteus minimus is the sciatica imitator. So it definitely is implicated when you're having butt pain. So I'm gonna link a video on how to release your glute min so you can check that out. It's key. And there's a video in this playlist, in the sciatica playlist, talking about glute min as the sciatica imitator and its contribution to butt pain. The final glute muscle is glute med. Gluteus medius trigger points tend to ache at the SI joint, at the sacrum, more centrally located in the bottom, in the buttocks. So if you're having butt pain that's closer in at the SI joint or along the sacrum, it can ache a little bit further out, but tends to be closer to the SI joint, and that's a big piece of your sciatica puzzle. You'll want to know how to release the gluteus medius. Also contributes to hip weakness, but that butt pain is just a pain in the butt, right? So knowing how to release gluteus medius well, that's going to be helpful for you. And the last one is piriformis. Of course, piriformis. Piriformis creates an ache in the butt that can also radiate down the hamstrings. Piriformis does not typically radiate down the outer thigh, not piriformis. It does not typically radiate to the outer shin. It does not typically radiate lower down in the leg, in the calf. Piriformis trigger points tend to ache in the buttocks, near the SI joint, in the center of the buttocks, out by the outside of the hip, maybe some down the hamstrings, but tends to be more focused in the butt. So I'm doing a whole video specifically on piriformis, understanding its symptoms and understanding what else you need to release when you're working with piriformis. But I'll drop a link in here to the other video about piriformis so that you can check that out also. I really want you to get that pain in the body is often referred from a trigger point that is somewhere not necessarily right near the place where you're feeling pain. There's a trigger point in the calf that refers into the jaw. That's how far away it can be. And sometimes it doesn't even make sense. So it's helpful to understand that that trigger points create pain that is not necessarily right where that point is, and also that it's a part of a concert. It's a whole system where things are out of whack, and that butt pain that you're experiencing might be coming from any of these muscles that we noted. Quadratus lumborum. Oh my gosh, quadratus lumborum is a big piece of the puzzle. It's part of that one hip higher than the other. It's part of that functional scoliosis. Quadratus lumborum, and I did a video on that, we'll link that below, also creates aching in the butt and aching at the SI joint that has that electric-like quality. I did a whole talk on that. Quadratus lumborum can cause that ache right in the middle of the butt, lower down in the butt, maybe even along the outside of the hip joint, maybe even inside the pelvis where you feel like that pain is inside your pelvis. There's no way that you can get to it. But understanding that it's a pain referral, that helps you to understand, oh, if I release that quadratus lumborum in my low back, I can get rid of that deep ache inside my pelvis and my butt pain at the same time. So trigger points can be a little bit tricky. You really want to work with someone who knows what they're doing and really understands the pain referral pattern, or else what you're going to be doing is kind of chasing a ghost. It's like, oh, that's almost it. Oh, that's maybe close, but not quite right. Or it feels right, but it never helps. Then you know that you're really not working in the right area. And it's not your fault. A lot of people even a lot of physical therapists and massage therapists and chiropractors, they don't always have skill in understanding trigger points and their pain referral patterns. So stick around to this channel, stick around to this playlist, because you're gonna learn so much and be able to really help yourself. One more thing, I am going live on Sunday the 25th. So join me 4 p.m. Eastern Time, Sunday the 25th, here on the YouTube channel. Bring your questions. I wanna help you. Take care.